Welcome to the Deep Dive. Today, we're digging into something really important, the Coeliac blood test. We've pulled together key info, relying heavily on sources like Blood Test UK. Our goal is to really, lay out the symptoms, the test itself, and maybe most importantly, why getting this sorted out early makes such a difference to your health long term.
Absolutely. This is all about giving you a shortcut, really, understanding what might be going on and seeing the huge upsides of getting diagnosed sooner rather than later.
Okay, so let's unpack that. What are those early signs, the things that should make you think, maybe I should get checked? Blood Test UK points out some classic ones, right? Like gut problems.
Yeah, exactly. The gut stuff is often front and center. We're talking persistent tummy aches, that uncomfortable bloating feeling, and, confusing trips to the bathroom, maybe diarrhea one week, then really bad constipation the next. It can swing back and forth.
It sounds really disruptive. But it's not just about the tummy, is it?
Not at all. And that's where it gets tricky sometimes. Think about how you feel overall. Are you just exhausted? Not just tired, but deeply fatigued, weak, maybe losing weight without trying. Or noticing a weird itchy rash, that could be dermatitis or herpetiformis. And for kids, a big one is slower growth than expected.
Wow, okay. That's quite a range of red flags.
Yeah.
So if someone's ticking some of those boxes, what about the test itself? How does that work?
Well, the test is actually pretty simple. It's just a standard blood draw, usually from your arm. What they're looking for in the blood are specific signals, antibodies like PTG and EMA. These are basically little flags your immune system raises when it's reacting badly to gluten.
Okay, antibodies. Makes sense. But I read something surprising about preparing the gluten rule. You have to keep eating it.
Yes, and this is absolutely crucial. It sounds counterintuitive, I know. If you suspect gluten is the problem, your first instinct might be to stop eating bread, pasta, all that stuff, right?
Totally.
But you mustn't do that before the test. You need to keep eating gluten-containing foods normally for at least 6 weeks beforehand.
6 weeks. Really? Why is that so important?
Because the test looks for the reaction to gluten. If there's no gluten in your system, your body stops producing those antibodies, those warning flags we talked about. So the test could come back negative even if you actually have coeliac disease. We need to see the reaction happening.
Okay. That makes sense now. You need the evidence in the blood. So that preparation piece is key. Let's shift gears a bit. Why the urgency? Why is getting this diagnosis quickly, as Blood Test UK emphasizes, so vital? What are the benefits?
Early diagnosis is paramount, really. It's about preventing long-term, often silent damage. Untreated coeliac disease can lead to some serious problems down the road. Things like osteoporosis, weak, brittle bones, or significant malnutrition because your intestines just aren't absorbing nutrients properly from your food, even if you eat well.
So finding out early stops that damage in its tracks.
Exactly. Once you have a diagnosis, you can start a strict gluten-free diet. And that's the key. It allows your small intestine to heal. Your symptoms improve, often dramatically, and your quality of life gets so much better. You prevent those long-term complications.
That's a massive benefit.
Yeah.
Okay, let's talk practicalities, especially for listeners near Andover. Blood Test UK highlighted that getting tested locally is quite feasible there.
Yes, definitely. Access is pretty good in the Andover area, which is great. Makes it easier for people to take that step. You've got several options. There's the Andover Health Center, Concord Medical Center. Also, Andover War Memorial Hospital offers diagnostics, and even some pharmacies like Boots Pharmacy might be involved in testing services. Booking is usually straightforward, too often online or just a phone call.
That's really helpful knowing there are convenient places nearby. So getting armed with this knowledge, like the info from Blood Test UK, really empowers you to take charge, doesn't it?
It absolutely does. Knowledge is the first step to taking control of your health. And just quickly, if that blood test does come back positive...
Right. What's next?
The usual next step is a referral for an intestinal biopsy. It's a small procedure to look directly at the lining of your gut, just to confirm the diagnosis and see the extent of any damage. And then comes the big shift, committing fully to that strict gluten-free diet.
Okay, so diagnosis confirmed, diet started. Is that it? Job done?
Not quite. And this leads to our final thought for today. Experts really stress that follow-up is important. It's not just diagnose and forget.
Okay. What kind of follow-up?
Regular check-ins, usually including blood tests, maybe every 1 or 2 years. It's all about monitoring how well the diet is working, making sure your antibody levels are coming down, that your gut is healing, and ensuring you're absorbing nutrients properly again. It's key for long-term health success. So, staying engaged with your healthcare team is vital.